Good day, everybody. My name is Craig Bettles. I'm the Director of Data Analytics here at Consonas Healthcare. And I just wanted to show you a new report that we've built for Consonas Copilot here on our demo account. So it's called the Partner Report, and it's here in the Live Data section. So I'm going to open it up here. Now, the reason we created this report is we heard a lot of feedback from you, our clients, that you needed some kind of report where you could enter in the filters in on the first page, and then that wouldn't expose any PHI data. And then as you're working with partners, you can go through and you can look at a bunch of different metrics with them as part of a reporting solution. So that's what we've created here. So you can see we've got a really wide range of filters here on this particular report. Of note, we've got a couple filters that we've preset for you. This is pretty important. The reason it's important is because these filters help make sure that you get an accurate readmission or ED visit rate. Again, we're only showing the ED visit rate if your EHR is able to have those fields to capture that data, but for most EHRs on the system, we do have the ED visit rate. Over here on the right, you can see we've got a little step-by-step instructions, and we've got a little note just kind of recapping what I told you about the defaults. So feel free to change the defaults if you want to. Do know that that can change your readmission, your ED visit rates. So I'm going to use this as an example. So let's say we're talking to a hospital system, and I'm more at the corporate level here. So I have a number of different facilities that I want to take a look at, and I want to look at hospitals across an entire hospital system. So I'm going to say Providence Hospital here. I'm meeting with them. I want to show them admits from any of their Providence facilities here in Oregon to any of my facilities. So I'm going to select that here. By default, I'm showing all acute care, long-term care, and psychiatric hospitals for my admit locations. I've got both my Medicare and my managed care payers. Now, if I wanted to, I could expand that out to Medicaid and then expand my episode type to long stay, but do note that will change the readmission and ED visit rates, and it could potentially be inaccurate. So for right now, I'm just going to show my managed care, my Medicare, keep it at short stay. But if they have questions about my long stay patients, I can change the payer type and the episode type to show that. Now, if I was meeting with a payer, I could leave my admit location to all admit locations, and I could change my payer name to a particular payer. Let's say I was meeting with UHC, I could show them UHC data. And again, I'm going to keep my diagnosis rank and my diagnosis group as all. But let's say I was meeting with Providence Hospital's just cardiology unit. Now I can go here and I can pick the two cardiac diagnosis groups, and then I'd be showing them a patient population that is filtered just to Providence and just to those cardiology patients. So I'm showing them just the patients they're interested in. And again, I've got some other ideas, things here I can change. Now I can change from a planned discharge to all discharges if I want to. Well, I should say that it's defaulted to patients who are not a planned discharge. This is, again, for those readmission rates, but I can change that if I want to. So enough about the filters here. Let's actually look at the data. You can see I've got a number of different tabs here. I go to admission details, and it'll show me my admissions from my top 10 hospitals that I've selected. I can see admissions by location. This will show all hospitals, but because I've narrowed it down to just my Providence hospitals, you can see I only have 6 in the data set. I can see which facilities are accepting patients from this hospital or do accept patients from this hospital. And you can see that's 4 of my 8 facilities. And then I can see all the patient details. Now, again, these patient details are scrambled to protect PHI, but the idea here is you're able to make those selections on the previous page, so then you can show them these tables with all the patient details without worrying about accidentally showing PHI. Go down here, I've got my readmission details section. So it'll show me the number of patients who readmitted, my readmission rate. Now the default date range is 5 years, that's why I have such a large readmission rate. But you can use that date slicer to change the admission date to the last quarter, the last year, year to date, whatever the hospital wants to look at. Again, I've got my patient details. Again, if your EHR records ED visits, we'll grab that and we'll show that here on this ED visit section. And again, I've got the key details here around my ED visits, including how long they're at the ED and their reason for transferring out to the hospital. Again, not all EHRs have that transfer out details, but if your EHR does, we do show that. Then I've got my facility length of stay and my payer length of stay. Now, again, one key note here with the length of stay is our day filter on this report is based on admit date. So if you narrow your date range too much, you might get an inaccurate average facility length of stay because it'll cut off people who admitted before that date. So especially if you're changing the filters and you're looking at long stay patients, make sure to set a date range that's appropriately long so you're capturing when those patients first entered the building. Now, that's going to be different than our other length of stay reports, which run off discharge date. We've also got readmission details here, diagnosis groups, top ICD-10s for patients with their readmission. We've got a list of our frequent flyers here. Again, this is really to help kind of identify areas where you can work with the hospital to reduce readmissions. You'll notice if I got a right click here, a lot of these charts have drill throughs. So I can drill through to the patient details for this particular patient. I can see their primary diagnosis, their secondary diagnosis, the reason for transfers back to the hospital. And again, I've got the same details for ED visits here as well. I've got my readmission discharge details. I can see if there's particular spikes as far as days or times of day for when patients are readmitting. And I can see my top reasons for discharge back down to the hospital as well. And again, I can right click through patient details. So let's say I wanted to look at all 30 patients who readmitted for shortness of breath. I could right click and I could drill down to those details as well. And again, we've got the same for ED visits. So that's a little recap of our partner report there. Again, you can go to that through the live data. It's at the partner report here. And again, one just quick note is be careful with the filters because changing them can change your readmission ED visit rates. All of that is noted on the first page of the report. I hope you enjoyed this training video, and we'll talk to you later. Thanks.